Brachioradialis, neutral, thumbs up position, hold that, push down. That's the test for brachialis. No flexion in the shoulder.
Can you tell me brachioradialis again?
This is brachioradialis.
Okay.
Thumbs up.
Okay.
Hold that. This is brachialis.
Okay. Thank you.
Okay.
Pronator, teres, and quadratus.
Okay, so pronator teres, I can show in this position, elbows extended, right? I'm going to pronate with the elbow extended. Hold that, don't let me move you. And now I'm trying to supinate. Okay? For pronator quadratus, here, the elbow is bent. Pronate, hold that, don't let me move you. I'm trying to supinate. Both my hands are on the forearm.
Supinator.
For supinator, here's the thing. Look, if I have the elbow bent like this and I supinate, what's going to happen? Yeah, biceps. You're setting biceps up for a strong contraction. So what I like to do here is extend. Slight supination, hold that, and now I pronate. Okay, so I'm pronating the supinated forearm in an extended position.
Extensor carpi radialis longus and brevis.
Okay, let's see. Extensor carpi radialis longus. Elbow's going to be extended. Extend, radially deviate, hold that, don't let me move you, I push down to the table. Okay? If I want to do brevis, bend the elbow, extend, radially deviate, hold that, don't let me move you. Okay?
Extensor carpi ulnaris.
Extensor carpi ulnaris, extend, ulnar deviate, hold that. Don't push down on the fingers, push down on the dorsum of the hand.
Flexor carpi radialis and ulnaris.
Flexor carpi radialis. So, sorry, here. I'm radially deviating. Then look at what I do. I say hold that, and then I just pull down. You can see the flexor carpi radialis tendon. For ulnaris, flex, ulnar deviate, hold that, and I lean back. So this one, if you let go of the position, their hand is going to change position. So passively move them into that position, have them hold it, and then just lean back to get the contraction.
All right, special tests. Lumbar thoracic spine, gapping, and squish test.
Can you lay on your back? All right, so flex your hips. All right. Good. You want the hips flexed. In this position, ask permission. Is it okay if I palpate? So for the gapping test, everything goes apart. For the squish test, everything goes together. There's a passive and active component of each of these. So the gapping test is testing the anterior SI joint ligaments. What I'm going to do is one hand is going to feel for the ASIS and the iliac crest and sink onto the inside of the iliac crest. Go to the opposite side and I always push apart. Any pain? Okay, next part of the gapping test, I put my hands outside the knees. Can you push into my hands? This is the active component. Any pain? Good. The squish test, I'm going to go on the outside of the os coxa and I'm going to push them together. So here, now I'm on the outside, leaning in, and then I reach across and now I'm squishing together. Any pain? Now I'm testing the posterior SI joint ligaments by pushing them together. No pain? Face away from the patient. Put your hands in reverse position. Put it in between the knee. Squeeze. Any pain? Okay. So here are the hands. And by facing this way, you're not going to like slip out and punch somebody in the groin. Okay?
Cervical spine, compression test.
Okay, can you sit in the chair?
Then distraction.
Yeah, so we're going to do a version of a cervical compression test. There are lots of versions. There are versions where you rotate, where you laterally flex, and they have different names. Jackson's compression test, cervical, there's all different ones. This is just going to be your standard cervical compression test, all right? What I want you do is you're going to make sure the feet are on the ground, their back is up straight. I'm just going to push down directly, straight down for 2 seconds. Any pain? Positive sign would indicate the possibility of the IVFE, which is intervertebral foraminal encroachment, a herniation, a ruptured disc. There could be any kind of pathology that's pressing on the nerve roots. It's worse when you press the vertebra together and compress the joints. Okay, the distraction test, there's different ways that people distract. I don't like it when people do it like this. It's very invasive. Your hand could be on their throat. It makes people very uncomfortable. So what we want to do is get our hands under the mastoid process. If you go like this, it's going to be hard. As you lift, they're going to like slide out, right? If you go like this and keep your elbows in and get underneath it and then lift up, your whole body is doing the lifting, okay? So I'm just going to palpate here. Mastoid process, I get underneath, right? Here. I'm making sure to bend so that I don't cover their ears, because then again, it's really weird. Here, and I lift straight up. Like this, though.
Oh, just not like.
That's why it's, yeah, don't do that.
So when you move your hand, they don't go.
I was like, how do you avoid that? What?
Yeah.
Popping deal. The Adson's, Halstead, and costoclavicular.
Okay, so for the distraction test, the pain would relieve when you lift them. This would indicate degenerative joint disease or IVFE, because as you separate the joint spaces, they are getting relief from that pressure. Adson, Halstead, costoclavicular, these are all the same starting position. What you're going to do is depress the scapula. You're going to feel for the radial pulse. So make sure that you get the radial pulse. Extend, supinate, extend the shoulder, extend the elbow. So in this position, I'm feeling the radial pulse. I'm going to say, Toriano, can you turn towards me? And look all the way up. Take a deep breath and hold it. Okay, so what I'm doing, asking them to take a deep breath and holding it, and then I take the deep breath, is so that I don't forget that they're holding their breath and then they pass out. So what I'm feeling for is a significant decrease in the radial pulse, which would indicate TOS, anterior and middle scalene entrapment. Halstead is going to be the same thing, but now I have them turn in the opposite direction. Now look all the way up. Take a deep breath and hold it. Okay, so that's Halstead. Costoclavicular, what I'm going to do is I'll show them. I'll say, can you do this? Right. So he does that. Look forward though. There you go. Take a deep breath, hold it. Costoclavicular. Now we're checking for TOS impingement between the clavicle and first rib. Did we do the Eden's test?
Mm-mm.
No? All right, don't worry about it. There's another version of that where you do both. It's an Eden's test. Don't, unless you really want it on the final. Not one person. Okay.
The right test.
The right test, the hyperabduction test. So what I'm going to do is I'm going to feel this pulse again. When I feel this pulse, I'm going to hyperabduct all the way up. Take a deep breath, hold it. See if there's significant change. Okay, this would be entrapment by pec minor, TOS.
Vertebral artery test.
We're not doing vertebral artery test on the final exam, but I may ask you questions about it on the written. Again, why? Because I don't want you to extend somebody's head off the table, laterally rotate and laterally flex during a final exam.
That's scary enough.
It's not a pleasant test. And, you know, again, what I recommend is that if you even think, if you're concerned to the point where, you know what, I really want to see, I'm afraid that their vertebral artery might be occluded on one side, send them to a doctor. I mean, I honestly don't know anyone. I know plenty of people who will do it, but I don't know anyone who has such skill in their assessment